Pharmacokinetic parameters start with the A of ADME: absorption, distribution, metabolism, and excretion. Now, before starting this, let me tell you, when I will say heparin, I mean this is the unfractionated or native heparin. And when I will talk about the low molecular weight heparin, I will specifically use this word, low molecular weight heparin. So let's start. Now, the drug absorption is not required in case of the heparin, as the drug is directly being injected into the bloodstream. Now you know that low molecular weight heparins are administered subcutaneously, and heparin through the IV bolus or the IV infusion. Usually, the heparin is initiated as an IV bolus to achieve the immediate anticoagulation. This is then followed by the lower doses or continuous infusion of the heparin, titrating the dose so that the activated partial thromboplastin time APTT is 1.5 to 2.5 fold that of the normal control. Now here is the point to remember. The APTT is the standard test that is used to monitor the extent of anticoagulation with heparin. Now basically it measures the time the blood takes to clot. Now the anticoagulant effect with the heparin occurs within minutes of IV administration and after 1 to 2 hours of the subcutaneous injections. Now the maximum effect, you can say the maximum anti-factor Xa activity of the low molecular weight heparin occur about 4 hours after the subcutaneous injection. It is usually not necessary to monitor coagulation values with low molecular weight heparins. Now, because the plasma levels of the pharmacokinetic parameters of these drugs are a bit more predictable than the heparin. However, in renally impaired, pregnant, and obese patient, monitoring of the factor Xa level is recommended with low molecular weight heparins even. Now, in the blood, heparin binds to many proteins that neutralizes its activity, causing the unpredictable pharmacokinetic parameters. That's why the heparin binding to plasma protein is variable in patients with the thromboembolic disease condition. Here, the monitoring is much more important than the low molecular weight heparins. Although generally restricted to the circulation, heparin is taken up by the monocyte macrophage system, and it undergoes depolymerization and desulfation to inactive products. Now these inactive metabolites as well as some of the parent heparin and low molecular weight heparins are then excreted into the urine. Renal insufficiency prolongs the half-life of low molecular weight heparin. Therefore, their dose should be reduced in the patient with renal impairment. Now the last thing, that is the half-life of heparin is approximately 1.5 hours, whereas the half-life of low molecular weight heparin is longer than that of the heparin, ranging from 3 to 12 hours. So that was a little about the pharmacokinetic parameters of unfractionated heparin and the fractionated heparin. Now let's move to the next section to discuss about the adverse effects of the heparin and what happened in the toxicity of this drug.